Pain has always been a challenge to treat. Individuals suffering in pain live very difficult lives because of the complexities and the lack of a solution for pain. Now, it's true that if you've broken a leg or scratched your arm, there are many medicines that can be used. Over-the-counter medicines like anti-inflammatory, ibuprofen, or a variety of non-steroidal anti-inflammatories known as NSAIDs are great drugs for this type of pain. However, when you have pain that's debilitating, affecting the quality of your life, some people consider using a group of medicines known as opiates. Opiates are derived from the same compound that's used to make heroin as well as opium. It comes from a little flower, a poppy, that is cut, and you get a substance that is used to extract morphine. Morphine was the original opiate used, and based on the chemical structure of morphine, today we have many different types of opiates. We have hydrocodone, we have oxycodone, we have dilaudid, we have fentanyl, we have methadone, and many more that belong to the same category of drugs known as opiates. Opiates were very popular in the First and Second World War, where individuals carried little ampules of morphine with them, and when they got injured in battle, they took this medicine and it was a miracle. They did really well. Their pain was essentially relieved. Based on the success of these medicines being used in war, the 1940s, 50s, and even the 60s encouraged all physicians to use these medicines. And there was a huge influx of opiate-type medicines in the marketplace. The United States consumes more than 80 to 90% of the world's opiate supply. And this is really based on the idea of giving individuals a good quality of life. But there also was a danger in these drugs that people didn't immediately realize. Using opiates such as morphine, hydrocodone, oxycodone, individuals have a lot of side effects. Simple ones such as constipation, such as sleepiness. Those are not the worst dangers these drugs offer. These drugs can affect the endocrine system, the immune system, cause depression, cause suicidal ideation, affect growth, affect sexual function. These drugs are very dangerous drugs. However, today in modern medicine, practicing pain management as a physician, we use these drugs rather routinely to help alleviate pain. However, it's very important to realize that these drugs need to be regulated. These drugs need to be monitored. And these drugs need to be given at the right dose. People who are on these drugs for over 6 months to a year develop what's known as tolerance, where your body gets used to the drug and you need a higher dose. And by going to a higher dose, that increases the side effects. There's also something known as dependence, where your body physically gets used to these drugs and need these drugs. As a result, any individuals on these opiate type of medicines cannot abruptly or suddenly stop them. Now, the newest concern with these opiate drugs is something known as opioid-induced hyperalgesia. This is a recent phenomenon that was discovered where when the dose of medication increases, people actually have worsening pain. So, because of tolerance and dependence, individuals keep requesting higher doses of medicines. But as we as physicians and practitioners provide that higher dose, the pain can actually get worse. So it's very important when managing pain and using these medicines to use a comprehensive treatment program where we use exercises, proper nutrition, diet, interventional therapy, and even alternative strategies to help manage pain. That, in the long run, is a better option to treat individuals with chronic pain. Now, these opiates are not frowned upon because they are great drugs for acute pain. They are great drugs for individuals suffering in pain, but they have to be used with caution and they have to be used wisely. Thank you.